Good morning, everyone. Welcome to the second webinar in our 8-part webinar series, Communication Strategies for Community Outreach and Education. In this second webinar, we'll be learning about professional development, elevating your role as a communicator in your organization. My name is Kim Norden, and I'm a programs coordinator for the Delta Region Community Health Systems Development Program, or Delta for short. We designed these webinars to be interactive, so we'll be asking you to complete some polls and answer some questions during our presentation, as well as a short exercise to help us apply some of the knowledge we learned today. We'll ask you to participate several times today by unmuting and using your voice, or you can use the chat box to add your responses. If you haven't already done so, please add your name, title, and organization to the chat box, which you'll find at the bottom of your Zoom screen. I'll be sending the slides and recording of today's webinar to you all next week. If you have any questions or comments today, feel free to use the chat box at any time. We'll save some time at the end of this webinar for our speaker to answer any questions that come in through the chat box. To avoid background noise and feedback, please remain muted when you're not speaking. Now let me introduce you to our speaker, Mr. Mike Mulligan, President of Legato. As a healthcare communications strategist, educator, and media trainer, Mike has directed strategic planning efforts for a variety of rural and other healthcare organizations, serving as counsel for CEOs and other executive team members. Mike is a highly requested speaker for healthcare national conferences, and he is a regular contributor to industry publications and blogs. Before founding Legato, Mike previously served in a communication leadership role for Previa Health in Green Bay, Wisconsin, and Director of Public Relations and Strategic Communications with Aurora Healthcare in Milwaukee, Wisconsin. When he's not writing strategic communication plans, Mike spends time with his family fishing, kayaking, and hiking with his 2 golden retrievers. Thanks for joining us today, everyone. Now I'll turn things over to Mike.
Thank you so much, Kim. Good morning, everybody. Thanks for taking time out of your busy schedule to join me this morning. We're pleased to be part of this program and support the efforts of the Delta program. And as Kim said, today is really related to the different webinar topics, but in a way a little bit of a different branch, in that we want to focus today a little bit more on professional development and just ways that kind of feedback that we also got from you from the survey that we did before. And overall, what we're going to talk about here are just ways that we can elevate our roles as communicators in our organization. And that doesn't necessarily mean, I know we have different people on in terms of different backgrounds, clinical backgrounds, communication backgrounds, people that are maybe in senior leadership or not in any way. We all can look at how we develop our role in the organization and to be a stronger communicator. So what we're going to talk about today is what that role is, share some thoughts with you in terms of what CEOs in particular, could be senior management, what have you, but in general, what their expectations are of communicators or champions. And along those lines, by the way, as we have, I know, different groups on this chat, if we have people who are in a senior role and they want to share their input, we would love to hear that as well, whether or not it's as we're talking or at any point. We'd love to get that feedback. That's what this is about as well. And then we're going to talk about a process in terms of just how in general to elevate the role of communications. And it's not always just the role of communications, by the way. It's elevating maybe your individual value in an organization, I think, is another way to look at that. Sometimes we have to overcome maybe what perceptions people might have regarding what a communicator does and what he or she doesn't do. So, and then generally, forming an action plan for how to actually take that information and put it into action. So with that, we just want to start out with a little bit of a base setting kind of thing. And if you could just respond to the question here, how confident are you in knowing the steps it takes to elevate your communications role within your organization? You can see we have a few choices here.
I'm just going to give people a couple more seconds to respond to the poll. Looks like about 65% have voted, and people are still submitting votes, so we'll just give them another second here. Can you see those results, Mike?
I can, where would I see?
Here
Oh,
we go.
now I can. Okay, so medium confidence generally, or high confidence. Okay, very good. That gives me an idea is that we generally feel pretty good, but we're here to kind of see what else we can learn to even make those scores higher. So that's a good baseline. Thank you. So what that process means is that we're looking in the mirror a little bit, seeing what do you see? Who are we as a communicator? Where are we currently? Where do we want to be? And as I kind of mentioned, what main role does your communications champion play within your organization? And that may be you, or you may be attending this webinar, kind of giving some mentoring or guidance for other people as well. But as I mentioned, there's, titles are, there's lots of different aspects here in terms of, um, you know, uh, communications director, public relations specialist, etc. So we have another question here, but just as what main role does your communications champion play within your organization? And it may be more than one of these as well. But I believe this is another poll, Kim. So I think we'll have people answer that real quickly as well. And I would say just choose maybe the most logical answer to this.
And we're still getting some replies right now. Looks like public relations specialist is coming in on top, followed by community champion. We still have some people voting, so I'll give people another couple seconds here.
Or all of the above. Should have had that be.
We should have. We know many people wear many hats, especially in rural communities.
That is for sure. Okay, that helps a lot. Community, okay, great. And again, I bet you some of these where you could say 3 or 4 of them in general. So excellent. Thank you very much. That's helpful too. Okay, so what we want to talk about now is kind of getting a little bit more into the substance of things. And one of the things that I want to kind of just leave you with today is that we'll talk in a second about just some feedback that we've gotten from, that we received from various CEOs in terms of what they're looking for. But the first thing I just want to share with you on an overall perspective is it's a mindset that we need to have. I think sometimes, and it's very, as we kind of have talked about, we're very busy with what we do and the tasks that we have and to move on to the next priority, but it's changing and making sure that we have a mindset that's more of a growth mindset. Ultimately, if we're in a position where we want to elevate our role and our value in our organization, it's demonstrating not just in our words, but in our actions that we have that growth mindset. And again, you'll receive a copy of this presentation so you can go through this in more detail. But you kind of see here on the left, we have what we kind of call more static intelligence, and on the right, we call fluid intelligence. We want to obviously be more on the fluid side, okay? So that we are demonstrating that we embrace change, that we react to it. Obviously, we're doing that right now with the pandemic. Of course, we've certainly embraced it and taken that on. But we persist in the face of setbacks. We see effort as a path to mastery. We learn from criticism. We find lessons and inspiration in the success of others. And those types of behaviors are contagious. Okay, those are things where when we look at in our organizations and we demonstrate through those kinds of actions, that's when our senior leaders, others in our organization say, okay, this is a leader. This is someone who, it's all about building credibility for yourself so that when you are really trying to elevate that role of communications, you have that framework to do that. It's really overall kind of moving, if you will, the perception of, if you're in some kind of a communications role, of someone that's more of a tactician to maybe more of a strategist. Obviously, we have to do both, but that's really ultimately how you move that role. So I'd just like to take a quick second again and just ask for some brief feedback in the chat box. Really open-ended question here, but what qualities or skills do you think CEOs want in their communications champion? You just take a few minutes and just, even if it's a couple of words or what have you, just kind of give an idea, and then we'll look at those.
And if you want to use your voice to answer this question, just feel free to press unmute and
Absolutely.
share
Yes, I'm the Geneva Bryant, the community champion for Pemiscot Memorial Health Systems. And I think that what my CEO is wanting in their with the community champion is just to be available to spread the word about our hospital. We're a rural hospital, and it's kind of an old building, but we're the only one in 2 counties, and just spread the word about how valuable our hospital is and how we need to, as a county, work together to keep our hospital alive and well.
Great feedback. And so in many ways, I would say that, we need that person to be an advocate, right? That's, and
Yes, yes, an advocate. We don't need, and if someone has a problem with our hospital, they can call the community champion, and then I will talk to the CEO about it. And I also do an emergency department. I do a random calls to see how their visit was and how they were treated and so forth.
excellent. Thank you for that. And as I'm looking at some of the other comments that are online here, I'll just, I see respectful, clear and approachable, someone who is objective, a people's person and relatable, positivity, discernment in what's appropriate, understanding of community's needs, collaborative nature, absolutely. Interpersonal communication skills and relationship builder, absolutely. So much about relationships and what we're looking for and what CEOs are looking for. Positive attitude, promotion of our services and employees, similar to the comment that was just made. Positive again, passionate about the hospital or the clinic. The hospital's cheerleader, again, that advocate. Bring ideas to the table. Yes, we're going to talk more about that proactive thinking. That is a key thing here. Public speaking skills, communicate effectively, open-minded, confident in their voice. These are all so good, people. This is great. Clear, accurate, timely communication, great communications, delivery of messages, ability to communicate and advocate. That's excellent. Excellent. That's really good feedback, and I think a good reminder for us all. So thank you for that. So just to kind of add to that a little bit in kind of preparation for this presentation, we asked a number of our CEO clients what they were looking for as well. And these are and this is kind of a consensus from CEOs from around the country, and many things that you mentioned here. Forward thinker, okay. The revenue generated and the results driven is one that I'm going to focus on here in just a little bit more. That one didn't necessarily come out in the feedback that you gave me, and I just want to share that is one that I think in terms of really elevating our role. I know that oftentimes we're in different roles in our communication in our organizations where maybe our role is more of a community advocate. And we certainly are here for our community to advocate, but the fact is that we are a business as well. So in terms of really elevating our role as an organization is really having that mindset of understanding where we can make sure that we're meeting the margin of our organization so that we can ultimately get to the mission of our organization. So being big picture, strategic, heard a lot of things about being a direct communicator, collaborator, I heard. So a lot of things, a lot of comments that you've made are in line with the feedback that we've received. So, and again, as I've mentioned, I think just the mindset I'm trying to focus on here a little bit is absolutely, we know we're in rural hospitals. We wear many hats. We don't have the luxury of just always being strategic. We got to get the work done. I get that. But what I'm trying to say is just trying to move our mentality to being doers and thinking ahead and being proactive. So as I kind of mentioned, elevating that role, kind of moving from a taskmaster to a problem solver, reactive to proactive. Someone had mentioned that just in terms of thinking ahead. Again, trying to think more as a strategy department and changing the paradigms that maybe people have about what communicators do or don't do in an organization. So let's talk a little bit more about how to do that. And so there's many steps, but we kind of focused it into 6 steps at this point, just to get you thinking a little bit. So the first is, as I've kind of mentioned a little bit before, is really taking on the mindset of a CEO. So just like we do in the normal work that we do, we often say, okay, well, what's the mindset of a patient? What is he or she thinking? Like any kind of communications, you put yourself in the shoes of your audience. And in this respect, and again, I use CEO loosely. It could be senior management. It could, but generally speaking, that role. And what is the mindset of that person? What is he or she expecting of you? Think of them again as how you're meeting their particular needs. So I mentioned a little bit before, in terms of the financial part of this, but as we know, a strategic plan isn't only about the finances. There's lots of different aspects in there, from quality to patient experience and service and all of those sort of things. And generally the financial part maybe comes under like a growth pillar or something like that. But anyway, really becoming familiar, if you're not already, with the organization's strategic plan, really understanding that. And if you're not understanding it, making sure that you're in a position where you're asking the right questions, because that is where you can be incredibly proactive. What I've found as an example is that sometimes there's a strategic plan where there's a growth section, and kind of the action steps will say, okay, let's have the marketing department, do this, this, and this. Well, there's so many other aspects in a strategic plan. It might be about employee engagement, or it might be about patient experience, or what have you, where a communications role can drastically impact that. But it's, again, kind of being a little bit more involved. And even if the communications role isn't listed specifically at that point, to kind of go back and to be proactive and say, what, I think I can impact this area, or this is what I should do. So we'll talk in a moment, but it really is, understanding the finances of the organization and how it works. And because by having that understanding, you're able to really be more proactive. And part of that is gaining access to trends. And we'll talk in a second about that a little bit more. So, but in terms of, the data, we look at, and these are, in fact, in our next webinar, we're going to get into a little bit more specifically in terms of how to form goals and those types of things. But, the kind of data that we want to be mindful of, these are some examples of that, of, patient volumes, net revenue generated. If we have some kind of community perception study, that's not always plausible, but if, for sure, even understanding from your community health needs assessment, lots of things come out from that. Really having a better understanding in terms of where referrals might be coming from for physicians or other professionals, where we might be losing market share. And then the big question is the why. So, and then the market analysis of this is really understanding from a larger perspective, what potential do we have in our market, and those types of things. Now, in terms of how to gather that data, there are lots of different, sources, and I can certainly, separately provide you with maybe some suggestions on that, what have you. But the thing that I want to just emphasize here is that oftentimes this type of information very well might be available already in your organization, but either you're not familiar with how to get it, or others don't really realize that you want it or need it, because they might have a certain perception of what you do or don't do as an organization. So sometimes it's just asking for it. And I can tell you just from experience that senior leaders just love it, frankly, when communicators, and I mean this seriously, go to them and they are inquisitive and are asking about understanding the finances of an organization. There's no better way in my mind to really build that credibility of showing that you have a strategic mindset. And again, we'll talk as we get in later in the series in terms of forming measurable goals and these types of things, but also just looking at various analytics The analytics can be about changes in volume, or they can be communications analytics. You can see some examples here of how to do that. So let's just talk for a second before I kind of go on. I'd like to kind of just understand from your perspective, what kind of measurable communications data do you currently track? What kinds of things do you track, either as a, from a communication standpoint or from a volume standpoint? And we'll just kind of open up the chat box, or again, if you'd like to just share via voice, that would be great too.
I'm having trouble finding my chat box. This is Geneva Bryant again from Scott Memorial Health Systems in Hayti, Missouri, and the deep boot hill. And I think, if I'm understanding the question, you're wanting to know how we communicate with the patients. Is that what you're asking?
No, but
okay.
And I'll explain it. But and again, if you're, and I'm happy to hear your voice, but on the chat box too, if you go into that more section, there's a chat thing you can click on there. What I'm really asking for here is just, generally when you're looking at how do you determine the success.
Oh, okay. Okay. There it is. Okay.
But no, but anyway, to answer your question though, what I'm really looking for is when you look at, types of communication that you do, how do you measure, right now, how are you sort of demonstrating, what are ways that you're demonstrating, that you're on track with what your goals are? And that may be lacking or whatever, but what kinds of things are you currently measuring? And I'm seeing some things come through here, and I'll kind of share those as other people are thinking about it as well. I have, let's see, we have electronic marketing services volume and the amount of communication output. Whoops. Sorry about that.
Read them off too, Mike, if that helps you out.
Sure, go ahead.
Okay.
I can't chew gum too,
It's hard to multitask. So Beth says phone call follow-ups, HCAHPS data, social media and website analytics. We recently conducted an internal communication survey as well that will be repeated annually. Great. Recently surveyed where patients get their information from, how many view our Facebook page. Outside of social media insights reporting or word of mouth data, we don't currently have a list of data measures we track as far as communication response. I hope to work on developing some with our marketing director. Social media and website patient surveys, numbers on social media posts, views, likes, shares, numbers on community events, handouts given in drive-through health fairs, etc. Social media again, flyers, word of mouth.
Wonderful. So that's good feedback. And one thing that I didn't hear a lot of is, so I heard a lot of communication goals, which is great. And what I would encourage is that we also go back, and again, it depends on what your role is in the organization in terms of what you're impacting, but looking at the business goals as well. So in other words, things like market share or volumes of certain, visits of primary care or other, if you're having specialists come in, or if you do have surgeries that are procedures or screenings, kind of those sort of volume related things to actually have some kind of a baseline, and then to kind of see what the impact is. So it's when we look at kind of building that credibility with our senior leaders, they generally expect that as communicators, we're going to share some of those data points that you mentioned. But in terms of having things that are maybe focused a little bit more on the actual, at least correlation with changes in volume, that's even a stronger case for you. So good feedback. I'm going to keep going here a little bit. So as an example, some of the things that I've mentioned here, these are a couple of examples kind of more from the business side of things, but this is kind of more from the opportunity perspective as you form your goals, but just a couple examples of this is getting a little bit more, in the weeds, but as you're looking at different services to get to a point where we're actually able to forecast maybe what kind of growth we're anticipating based on different demographics in the community and such. And this takes, sometimes your financial department might have programs and access to this, and they might not realize that that's something of interest to you, or there are other ways to get this. Obviously there's a lot of state data. We use the advisory board information and such. So the data isn't always accessible, but if it is available, very helpful to kind of use those as a tool. So again, looking at opportunities in terms of actual specific procedures and those types of things. And again, we'll talk more about how to form goals here in our next webinar. But you can see here, as we kind of are looking at more data, we can see that, okay, we can kind of see potentially where we could be in 3 years, 5 years, and we can kind of look to see where are we now. And then by having this kind of data is where we can form some specific business goals as well. So that was kind of the first part, is, in terms of elevating. Number one was thinking like a CEO. Second is actually schedule an interview with your CEO. And again, depending on the hierarchy of your organization, certainly want to get, permission in terms of that you're not stepping in any political toes or things like that. But I could just tell you that by really just, scheduling time and really, getting in front of a CEO, these are some questions you might ask. What should the role be of communications within your organization? How do they define success? Where would they like to see improvements? What suggestions would they have for you for how to better understand the finances of healthcare? Sometimes, earlier in my career, I would do this, and I actually sat down on a pretty regular basis with the CFO of organization, and he trained me, honestly, to kind of know what kind of data to look for and things like that, and just really was appreciative. I mean, generally, I'm say this tongue in cheek, but marketers and communicators and CFOs aren't always aligned with one another. So I kind of, to kind of form that bond is really important. So again, it's having that mentality to seek out that data. And then, when you're speaking with your CEO, you want to get into more detail of this when you're doing your marketing planning, but really to get some idea in terms of broader organizational goals. Certainly having that strategic plan that maybe you've reviewed in advance, so that when you go and you kind of do these interviews, you can kind of go back and say, well, I see this as a strategic plan. How is this being addressed? Is this something that I could assist with? And overall, those, just having that conversation and understanding at the very start really helps to open that channel of communications and put you in a position to even be more successful. And then you can start to talk about maybe what some of those measurable and specific goals would be. The third is that we've kind of talked about a little bit, is really gaining that knowledge as a forward thinker. So this is where, and I'm sure a lot of you are doing this already, and it's just a matter sometimes of just, as hard as it is to try to make the time to continue to learn. When I, was in my undergraduate, and, it was in journalism, okay? Kind of think about how journalism has changed from way back then to now, in terms of, just the digital aspects of things and have you. And so I've, just like anybody else, needed to continue to learn, continue to educate, to go to conferences, to learn from others, to learn from people on my team, and so really setting aside that time to do that, but looking at what are others doing, identifying trends, just, really branching out and looking for new opportunities, seeking, obviously a lot of things now are done virtually, and there's lots of opportunities to do that. In some ways, even more opportunity, because we don't have to worry about the cost of travel and all those good things as well. So I want to just take a second and talk about this part here, which is developing a competitive analysis. Now, depending on where you are, and, sometimes our competition is a larger municipal organization or larger, in a larger geographic area, or it might be another critical access hospital, or it might be both. Um, and but really taking the time to actually step back and to say, okay, let's take a fresh look at how we're stacking up against our competition. And one of the things, besides this just being a valuable exercise, is that this does also form as excellent nuggets of information to go back to a senior leadership team, and not really even, you don't even need to let them know that you're doing this up front. I think it's more of a proactive thing to say, um, I took the time and I've done a competitive analysis. I know that we're somewhat familiar with, obviously, with these organizations, but I've taken a deeper dive, and this is something that I'd like to share with you. I think that it might provide some insights to you in terms of maybe perceptions that we've had or different things. And so part of that competitive analysis, and this is really more from a communication standpoint, but you're going back and you're saying, you're doing a study and saying, what are they currently communicating? What are their messages? What are the strengths and the weaknesses? How are they, do they have some actually points where they can differentiate from you? Are there areas where maybe they're vulnerable in terms of their messaging? And I know that, we don't always think, because we're in patient care, or, we're in smaller communities, and we don't always like to think about competition per se, but the fact is that we do have competition. And so we need to be aware of that to help kind of shape our communication messages. And that way we can make decisions that are based on facts and not just emotion. And then to this last point, I'm just telling you from experience that if you take the time to do this, and then schedule a presentation with leadership of something that you weren't even asked to do, but you proactively did this, one, you're going to learn so much but also that it really does even further, cement your role as a strategist in your organization. So then the fourth point here, in terms of kind of how to get to that point, is certainly developing an annual communications plan. And we're going to apply that knowledge that we've had. And we're going to form a consensus on various business goals and communication goals. And as we'll talk about more in the next session, these goals are going to be very specific. Okay. And the key that I've learned on this is that we can have all the different things that we want to do in our communications. We're going to do so many special events. We're going to do, budget permitting. We're going to do a direct mail, or we're going to do this, or we're going to do that, and all kinds of activities. But the most important part is coming to a consensus on what we're trying to achieve, and then sometimes even what we're not trying to achieve. So, because we have to provide that focus. So as an example, and now that sounds a little broad, but for instance, some of the broader goals are going to be specific things such as, it might be, we want to increase the volume of primary care visits from here to here within this period of time among this demographic in this geography. Okay. And looking at data to be able to form that specific goal. And then you might have another goal depending on whether or not you have, if you have the luxury of having a specialist come in and doing surgery, for instance. And this isn't always available, I realize, but let's say, for instance, that you have a visiting urologist that comes in, and you want to say, well, we want to increase the number of procedures of this specific procedure, from this period of time to this period of time among this demographic in our secondary service area, whatever it might be. Once you have those goals, and you kind of imagine how it really does focus your thinking, and it also focuses your thinking in terms of other things that come up that you really have to say, well, that seems important, but gosh, how does that support the goals that we've decided upon? And the key is what we've decided upon. And the takeaway that I want to leave you with you, and this is why I say that forming goals is the most important part, because this has to be something that your leadership team owns. They have approved these goals and a finite amount of goals, and that what you're going to be doing as a communicator is always supporting those goals. And then I'm hitting this in a broad stroke, but the process would be, though, that as new opportunities come up, that there's a discipline that's in place that says, how does that apply to those goals? If it doesn't apply to those goals, should we be doing it? Or, so that's the mentality. And so and then ultimately we can look and say, how did we do against those measurable goals? And you can kind of just think about that as how it might allow you to focus in terms of it, because I've definitely been in your shoes as well, and I know that what political pressures we have in terms of somebody who's really influential and says we should really do this and we should really do that, and we're pulled in a number of different directions. So anyway, as we get into the planning of that, we'll talk a little bit more next time, and we're actually going to do an exercise on forming specific goals. But again, in terms of the context of today, that's extremely important. And then from there, you're developing that communications plan, again, that's going to have those specific objectives and measurable and timing and all those types of things. But again, it helps you all also to say, okay, we know that it's human nature that we get focused a lot of times on things that we're really busy, but are they ultimately working toward those goals? We have limited resources, and it's just about being kind of more strategic in what we do. So the last point here in terms of well, actually, I think there were 6, but the next part is here, just leading the process. So, we kind of talked about those goals. Once we have those goals, it's communicating on a regular basis how we're doing against those goals. And, hopefully that you have an invitation, if you're not at the senior leadership team table, of maybe, seeing if you could get, a quarterly visit, whatever it might be. But really talking about and showing how we're doing against those goals that your leadership team, agreed upon, and really have that be your basis. Now, part of building trust and credibility is being transparent. So being transparent doesn't mean that you just promote and communicate the good news. You also communicate maybe what didn't go well, because just like any data point, you use that as a management tool to say, okay, what worked well, what didn't? If it didn't work well, why didn't it work well? Was it about the message? Was there a customer service issue? Was there an insurance issue? Whatever it might be. And when you're presenting this kind of data, maybe in front of a senior team, and you're actually letting them know of what didn't work well, but here are some potential solutions, and then you engage that group or engage your CEO in those problem solving, then all of a sudden, without you even really asking for it, you're part of that strategic conversation already. You've already really made that happen. And then your role is elevated in your organization in terms of being more of a strategist and less of a tactician. This last point here, being visible. And, we certainly communicate that to whatever role we can be in. We know we have maybe some limitations now in terms of, where we're going and what meetings we're going to and all of that with, following, safe distancing practices. But, just in general, the concept behind here is that we heard a couple different times in the feedback that we're an advocate of our organization. Couldn't agree more. Now, being an advocate means keeping your eyes and ears open, whether or not it's things that are in the community, or it's things in your organization, or it's listening to people. It's just creating a greater understanding of the needs of an organization. As a quick example, when we start to work with an organization and we're on board to do, to do a marketing plan, what have you. But one of the things that we do is just observe. I will walk, you know, for one, I'll kind of see what kind of security they have and what have you. But, you know, I'll walk the facilities and I'll see what I observe. I'm going to look at things from a signage standpoint. I'm observing how I'm greeted. I'm observing, you know, just being totally aware of anything from, and that's your role as a communicator as well. You know, just not taking things for granted because maybe you've worked there a number of years, you know, and again, as you observe those things, those are all, you know, you're an opportunity to improve what your organization's doing, and not again necessarily just bringing problems to the forefront, but bringing problems and solutions to the forefront. I noticed this. I think this is what we should be doing. So last couple of points here in terms of being visible, you know, scheduling regular communication updates, of course, whether or not you're part of maybe the employee forums that are going on or what have you. But as a communicator, people want to hear from you. You're, you know, most likely very influential in your organization, regardless of your title. And just, you know, looking for various opportunities to do that. And there's lots of virtual ways that we can do that as well. So, all right. So I want to take a moment and have a little fun here. So kind of, so this scenario here is, you know, a little bit of a tongue-in-cheek scenario, but in some ways it probably resonates with you. So here's the scenario. You're a one-person department, and many of you are nodding your head, I'm sure already, responsible for employee communications, external messaging, newsletters, website, community relations, patient experience, maybe crisis management, special events, and in your spare time, maybe doing some landscaping and some building maintenance. Wherever needs to happen, it kind of falls into your role. And as you're doing that, your CEO stops by your office and says, you know, I was speaking with Dr. Needy, and she would really like to see her photo on the next outdoor board over on Highway 54. Can you get on that? You may have actually heard this very question. I know I have in my career. And I know it's a little, you know, a little out there maybe, but what I'd like to do is just to have a little dialogue, and knowing that you're working on, you know, developing your role as a strategic leader, kind of thinking about some of the things that maybe we talked about already today. I'd like to just get some feedback in terms of how you might respond to this request. And certainly either option is great in terms of chat or voice, but I thought this might be one that might be a little bit more conducive for people to kind of have a dialogue through voice, and just to, you know, to talk about that a little bit. So just remember to unmute yourself as well, but maybe when you're not speaking, to go ahead and mute yourself, just so that we don't get too much background. So again, what I'd like to just have is a little bit of dialogue. You see this scenario, and you know, how might you respond to this request? And that response could be something that maybe is a short-term answer, and there might be a long-term answer. So love to open it up for your feedback.
Yeah, I'd like to take this one. One thing, I think it's great that the CEO would be bringing some ideas to that. So what I would like to do is find out, one, is Dr. Needy in a field or specialty that we're generally trying to push? One, it also depends how recently had we just changed out that billboard, the extra cost that would be incurred of putting new vinyl and new artwork, and then use that as a segue to get into conversation about, hey, you know what, this could be a good idea with our strategic plan. Here are kind of some general directions that we're going on. Does that fit this time frame? And use that as an opportunity to open the door and grab their busy ear to kind of work in your ideas.
Awesome. I'll wait to respond until I get some other input, but thank you for that. That was very insightful. Other thoughts? Anybody heard a question like this before? No?
Okay, I'll speak to that. I've gotten this question quite a few times, actually. And I have to agree with Amy. I would just do the same thing, use it as an opportunity to say, okay, does this fit in our goals? Kind of put some things together for the CEO and get a chance to meet with him and just kind of discuss some things and see how we can move forward.
Okay, that's great. And I realize that this is a, you know, I'm also a realist and a pragmatist, that, you know, sometimes there's politics and there's things that have to be done. And so there might be sometimes where there might be a short-term thing that you need to do. But how do you think, how could you turn this, I guess, in a way that is an opportunity where, okay, we have this request, but how can we change the mentality of being less of a tactician and more of a strategist? How do we do that? Love to hear other people's feedback on this. I know you're all communicators. I know you love to talk. So love to get some other feedback. If you heard this, how would you respond? What would you do?
Is it something that you would work into the strategic plan and looking at, you know, how it could fit? Or is it something that you would say, okay, we don't have it in the strategic plan for this budget year. Can we look at ways to bring it in to the fold for the next budget year?
Great. Thank you. Any other feedback? Love to hear.
Yeah, I'd like to add also, you know, going in with a positive, open mind, you know, one thing that I'm sure we can all relate to is that we need to, you know, focus on the big picture and focus on the goal, but be flexible in the methods. So, you know, talking about Dr. Needy, wanting in that specific place, one, make sure that goes back to market analysis. Does Dr. Needy have patients in that area? Are there other people that are taking patients from that? Kind of making it a non-emotional or knee-jerk reaction, and trying to make sure, one, that that's the doctor or the service that we need promoted in that particular area. And then also it may be something that, just like, I know your name's not posting, but the other lady that was speaking was, you know, could it be that, you know, if that's not a feasible option for such a large format thing, are there other options like an EDDM direct mail, flyers, targeted social media advertising, different things like that, that could maybe put it out in a more expedited fashion as opposed to redoing a big display sign?
Wonderful. Wonderful. So very good answer, by the way, all great answers. So putting yourself for a second in the shoes of that CEO, what do you think his or her motivation is, or what, you know, when they ask you to do this, what kind of things might be going through their mind in terms of why they're asking you to do this? And again, I know you don't know the situation, so it's hypothetical. But what would potentially be their mentality? So they didn't necessarily just come to you and say, we need to put Dr. Needy on this outdoor board, but there was actually a conversation that the CEO had with that doctor. So what kinds of, you know, what kinds of maybe pressures or mentality does a CEO have after he or she had that conversation that prompted them to come and talk to you about this?
Keep the physicians and providers happy.
And it's a delicate balance, right? It's a delicate balance, and there's a lot of different factors. But just, I guess the point is that, you know, it's probably obvious, but just that we understand that that mentality is okay. But there could be a lot of different factors going on. Could be anything from, you know, who knows, in terms of just overall physician satisfaction, wanting to keep that position. Maybe even though, yes, we want to we need to be strategic and we want to look at all these longer term goals, there might be a pragmatic reason why we need to appease that physician. Now it's a balance, and we always have to have that conversation. And as you know, we kind of talked about that there's flexibility that we need to have. So we also, I guess I'm not saying that we always have the opportunity just to be hardcore, but we need to have that conversation with that CEO to many of the things that you've said, which is, you know, yes, I understand. Can you tell me a little bit more about, you know, why you're asking that? You know, as you know, really, you know, our strategic plan says this, and we do have a, you know, a need to do that. I would prefer that we would do this in terms of this overall goal, but do you feel like we need to do this now? But then to another point that was made, which was excellent, is, you know, it's like the same mentality where how many times will people come to you generally internally and say, I need a brochure, okay? And the key is to step back and understand the goals, you know. Dr. Needy maybe not really understanding how different media work or what's effective. You know, you might come back and say, you know what, CEO, we're going to figure out how we can say yes to Dr. Needy, but it may not be exactly how she, you know, found the answer to be. So in other words, you know, who knows what it might be, but the solution might be more of a digital approach, or it might be, depending on what, you know, her specialty is, might be more about referrals or whatever it might be. But it's really going back and having that strategic mindset. And then the other points that you all made are excellent as well, that this is an excellent opportunity to segue into that strategic conversation. Maybe you haven't gotten to the point yet where you have these established goals that your leadership team has agreed upon. And if not, and maybe you don't have really a communications or a marketing plan that fully matches that, that's a perfect opportunity to say, I absolutely understand, and here's what we're going to do in the short term. But you know, this is a great example of why I plan on doing this. I'm going to be working with, you know, your team to develop this and this, so that we can, you know, sort of minimize our surprises, but manage our resources and be the most effective with a limited budget. So this is a great example, and this is the process that I want to go through. Or on the other scenario, if you already have, you know, a strategic plan that's in place and a communications or a marketing plan that supports that, and you have those objectives that are already established, then, as many of you have suggested already, that's the opportune time to say, you know, without, you know, always being respectful and such, is absolutely understand the situation, even put it back to them and say, how do you feel this request fits into our goals that we've established? Does this fit into those goals? Do we need to form different goals? Really kind of bringing it back to that strategic conversation. I've been there, so I fully realize that, you know, you may look at my response and say, well, that's in a perfect world, and I absolutely understand that there are politics and there are, you know, demands and those types of things. So I'm not saying that this is, you know, always going to work exactly that way, but I think the overall message that I'm leaving with you here today, I hope, is that by building that credibility, you put yourself in a position to be heard more, and to be taken, you know, from a credible perspective when you challenge the status quo. So in terms of what we've learned today, hopefully, you know, again, what CEOs expect from their leaders, anything from having that mindset, and then from there, maybe, you know, scheduling some time with him or her, gaining knowledge as a forward thinker, developing that plan, leading that process, and being visible. So before we take any other questions, I'd just like to kind of ask this follow-up question again, which is the same question we asked at the beginning, and that is, how confident are you in knowing the steps that it takes to elevate your communications role within your organization?
I just want to say thank you to everyone for participating with your voice and in the chat box. We got some really good ideas and tips in the chat box as well with that last discussion.
Great. Sorry, I'll go back and look at those too. Sorry.
No, that's all right. All right, we have about 60% of people have answered the poll. Okay, there's the results, Mike.
Great. I will go back and look, but I think those are higher. I hope.
They are.
Yes. Okay. Good. Good. You know, in closing, I just, again, want to say thank you for taking the time. I also just want to let you know that, we covered a lot here today, and certainly you'll have access to these slides, but I always like to help people. And if you want to contact me directly with questions that you have or things like that, just as part of our partnership, I'm happy to do that. There wouldn't be a fee for that or anything like that. Just, I love to help people out. And so if you're, as an individual, looking and saying, okay, I heard this in the webinar, but how do I exactly do that, or what have you? We're here to help. So in terms of our next webinar, so again, we're going to build off of what we talked about today. And this is about, maximizing your limited communications budget. It's going to have a higher focus on planning and really focusing on prioritizing what you're doing. So that's how you maximize your budget, by providing a focus for what you're going to do and what you're not going to do. And again, here's my contact information. If you have any other additional questions or would like some guidance on how to further develop your professional development goals in your organization. I know we just have a couple of minutes left. Any other questions before we conclude today?
And you can unmute, or you can put a question into the chat box. One thing we hear a lot, Mike, is that during COVID now, the focus is much more on short-term solutions, and kind of people have begun stepping away from the annual plan. How do you get your CEO to not forget about other goals agreed upon for 2020 in the midst of a pandemic?
Well, we're finding that a lot of organizations are really doing both. They have to be cognizant of what's happening, but the mindset is that, if anything, the long-term plan, there's an understanding that it's fluid, that you still have to do the planning, but you also have to be knowing that it might change again in 2021. But that doesn't mean that you shouldn't plan for what you're going to do now. So it's really having, if they understand that mentality and work with them on doing that, because again, this is a delicate balance because we're focused on COVID and such, but there's also an aspect where we do need to continue to work on the business of our organizations, and just, finding that balance and having that conversation. But again, I think it's just understanding that there's some flexibility that has to happen there on administrators' part and from the communicator's perspective.
Great. Thank you so much, Mike, for this wonderful webinar. Great information. And I think we're all looking forward to next week at the same time in the same place. Thank you, everyone, for joining us today.
Okay, take care, everyone. Thank you.